You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
The testimonials appearing in this podcast reflect individual experiences and individual results may vary. Cardinal Health does not claim, nor should the listener assume, that any individual experience recounted in this podcast is representative of what another consumer may experience.
The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Calori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts. Hello, everyone, and welcome back to a very special episode on the Cardinal Health Counter Talk podcast. I'm your host, Jason Calori, and today we are taking a deep dive into the 2025 NCPA Digest, some of the interesting findings from this year's digest, and how you can utilize this data to inform policymakers from an advocacy standpoint. Today on the podcast, we have an all-star lineup to unpack all this information. First up, we have Doug Hoey, Chief Executive Officer of the National Community Pharmacists Association, who represents the owners of over 18,900 pharmacy small businesses. Also from NCPA, we have Lisa Schwartz, Senior Director of Professional Affairs, who has contributed to the NCPA Digest for many years and is now the Project Director of the publication. We also have Michelle Britt, the Cardinal Health Senior Vice President of Retail Independent Sales. With over 25 years of experience with Cardinal Health and interacting with customers, Michelle is an incredible resource to hear what exactly she's seeing and hearing out in the independent pharmacy market. And finally, Rebecca McGrath, Senior Vice President of Government Relations and Public Policy here at Cardinal Health. She currently leads federal, state, and global government relations for Cardinal Health and can provide some valuable insights on how you can make the findings from the 2025 NCPA Digest actionable. So everybody, welcome my esteemed guests. How are you guys doing?
Doing well. Thanks for having us.
All right. Well, welcome to another great podcast. Always excited to talk to you guys. And it's one of my favorite times of the year when the NCPA Digest comes out. I enjoy reading it probably as much as everybody else, just to see what those numbers look like, some of those findings and some of those intricacies within those numbers where people can utilize that to either build their business and make some differences within their own pharmacy. And not only that, but advocacy as well, which we'll get into. So first question, I want to just kind of throw this out to Doug and Lisa first. On a previous episode when we talked about it, you shared insights on the NCPA Digest long-standing history in the pharmacy industry. Can you guys give us a little bit of a refresher on the purpose of the report and kind of the genesis of it? How did it get started?
Well, I'll start with the genesis of it. And although I wasn't there at the genesis of it back in 1932, so the Digest has been around for getting close to 100 years, not quite, but started out in 1932. It was called the Lilly Digest, the drug company Lilly. And for 60 years, Lilly was supported it. Originally, it was as a business tool for pharmacy owners. So back in the 30s and 40s, Lilly would actually do a per store analysis on the pharmacy's business operations and give them some tips on how to improve business operations. Over time, it has become a benchmark for the industry, for the over 18,000 independent pharmacies in the United States. And in the early 90s, Lilly discontinued its support, and NCPA took it over about 30 years ago. And again, ever since then, it's kind of the go-to benchmark for our industry. You know, it's a very disparate industry, and this compiles not only business data for pharmacies to use to kind of know where they stand compared to their colleagues, but also clinical practice, how pharmacies are incorporating clinical services into their pharmacy to grow their business, differentiate their business, and become even more valuable to healthcare across the country.
Yeah, Lisa, what is your take on actually not only the beginnings of the NCPA Digest, but, you know, kind of building it and your experience over the years? I mean, what do you think it means for NCPA to have this long-standing history with the Digest?
It certainly continues to be an important tool for members to understand where their business is at relative to other independent pharmacies, help them track where trends are going. It helps us as an association track what's going on with our membership, make sure that we're providing sort of education and services that they need, so that when something starts to look like it's a promising development in pharmacy practice, that we're there to make sure that if they bring it into their business, they do it in a smart way, in a way that's going to make money for them, and a way that's going to help them take better care of patients.
For sure. One of my favorite pieces of the NCPA Digest is actually the very beginning, and it's the welcome letter. The welcome letter is one of the first parts of the digest that you see. Now, this year it's co-written by Doug Hoey and Brad Cochran of Cardinal Health, and it kind of gives you a little bit of a pretense of what you're going to be seeing and hearing throughout the digest. So, Doug, I'll start with you. From a digest standpoint and kind of an overarching thematics that you've seen with this year's digest, which data points were particularly interesting to you? Which ones jumped out?
Well, I'll get to that. I just want to tease up a little bit the digest, because it'll be coming out next, at the NCPA annual meeting in October.
Perfect.
And just to tease up, earlier in my career, I was responsible for the digest, and you mentioned reading it at night. I would be outing myself as far as my social life, as far as how many weekends I would spend either as a pharmacy student or as a young pharmacist reading the digest for my late night entertainment. Lisa has done a fantastic job. So I'm pretty invested in the digest, and Lisa has really done a fantastic job with this year's digest. And I don't say that as false flattery. I say that as I'm kind of a hard grader, and it's really good this year.
For sure.
To your question, one of the things that stands out, just pops out, is the impact of GLPs. The revenue side of pharmacies, we say in there that it's the highest in 10 years. It's the highest ever for pharmacy revenue. It's over $5 million, well over $5 million. That's, for all the PBMs out there, they're taking notes hurriedly to say, oh, pharmacies are making lots of money. Well, the other thing that sticks out is that gross profit is the lowest it's been in the last 10 years. And I did not go back and fact check the last 97 years of digest, but I would guess it's probably the lowest gross profit probably ever at 18.2%. And it fell from 19.7% last year to 18.2%. So that is a massive fall. It suggests that the increased revenue from the GLPs was really, for the most part, either treading water, like just not making any profit, or actually losing money on those increased dollars. So those are a couple of things. LTC is up 10%, so more and more pharmacies getting involved with LTC at home. Cost to dispense a prescription up to $15, and the clinical services, and Lisa may want to dive into a little more specificity, but they're still coming in solid. Adherence and immunization still the vast majority, but Lisa, you may want to talk a little bit more about some of the trends you saw on the clinical side.
Yeah, it's like point of care testing continues to be something that's very strong. A lot of interest in offering that as a clinical service, and we see that play out in the demand for the education to learn how to do point of care testing. Make sure that your technique is good for taking a specimen and performing the test and interpreting it correctly. And hand in hand with that, we've also seen. Just on a little bit different note, a little bit of a drop off in the number of pharmacies that reported having a collaborative practice agreement, which is interesting. Maybe some of that was necessary for some of the services that now states give a pharmacist just the authority to perform and do. But I think that also reflects another trend on the on the physician side, smaller physician practices getting scooped up by bigger organizations, and those physicians not having the same sort of autonomy to decide that they want to go into collaborative practice with a pharmacist. So like those two things together, I think are signs that we want to continue to see modernization of pharmacist practice and make sure that there are continuing to be more things that a pharmacist is authorized to do. The things that they're trained to do, they are also authorized to do.
So one of the things that I found interesting was the GLPs that you mentioned, Doug. And Lisa, Michelle, if you guys want to chime in here, have you guys remembered do we want to call it a trend? Is it a trend? Is it a trendy thing, the whole GLP thing? Or, it's a significant part of a pharmacy given the numbers in the NCPA Digest. Do you remember anything from the recent history that you could point to that was similar in all of a sudden a product like this hitting the market and generating a lot of revenue for a given entire year?
No, based on my recollection, no. Nothing ever. There have definitely been trends in the industry, and you've seen some things that would maybe cause some revenue to pop a little bit, like going, sort of way back for some, SSRIs, when Prozac hit in the late 80s, early 90s, the statin drugs, when Lipitor was ruling the world, and even, Zantac and the H2s, you saw a little bit of a pop in revenue from those. And
I remember when Lipitor went generic and everybody went wild. That was pretty significant.
And you saw that in the numbers as well. But nothing that I have ever seen like this. I suppose during the COVID years that we saw some big bumps because of the COVID vaccinations, and what at least was like 21 and 22. Is that?
Mm-hmm.
Yeah.
Yes.
We saw those bumps, but as far as I've never seen anything like it in my career.
So I actually want to get Michelle's standpoint on this, especially when it comes to that intro letter I was talking about, and it does talk a little bit about independent pharmacies nationwide contracting, coming down a little bit. And Michelle, I just want to get your standpoint on the findings that you saw in the digest, and is that commensurate with what you're seeing out in the field?
Yeah, I would tell you there were so many interesting findings. We can definitely start that with the decline in the number of independent pharmacies nationwide. That is consistent with other public data showing a contradiction among traditional chain pharmacies. It also reflects the growing attention to pharmacy deserts in recent years. In some areas, independent pharmacies are filling geographic access gaps to provide quality, reliable care. I know there was a Drug Channel's video called Pharmacy Shakeout, Why U.S. Drugstores Are Disappearing. And in there, it validates that there have been a number of significant store closures across major chains. So for instance, Rite Aid closed all stores and Walgreens absorbed many of these. There's also been a decline over the past several years, 8 to 16% from 2018 to 2025. And when you really think about some of the factors that are impacting these numbers, at the macro level, really generics, low price products are most of the sales. The chains are not picking this back up on the front end, which is an opportunity for independent pharmacies. So through our recent opening of our Consumer Health Logistics Center, we're expanding our capacity to serve in this area. Mm-hmm. And we offer several solutions to support the front end of our community pharmacies.
Can I add to that, Michelle or Jason?
Yeah, go for
Absolutely.
it.
That's the ability to add to those front end sales is so important. This year, it's up to 95% of all the sales are prescription. And some of that is because GLPs are so much higher. But what we typically see is that the more financially healthy a store is, the higher their front end sales are. And so to have that ability to increase your front end sales, because those are non-PBM sales, mm-hmm. So you have more control over how you price it, how you market it. You don't have the PBM overlords dictating things. You can also use some of your own creativity and ingenuity in the marketing of it. But I think it's a fantastic point that being able to increase the front, and that's easier said than done. I know that's true, but any incremental growth that pharmacies can see on those front end sales can often substantially improve that bottom line.
I mean, if you just look at the numbers, because the number that stood out to me was the amount of prescriptions was a lot higher than it was last year. You're talking about 67,000 and change versus 59,000 in the previous year, yet overall numbers for pharmacists are down. So the GLPs, the PBMs really coming in and kind of stripping that away from everybody, that extra revenue. But I think a point that you had made, Doug, earlier on, and I do want to get Michelle's standpoint on this as well, is those care gaps, the care gaps that are within each community that a pharmacist can now have the ability to serve has been really crucial in growth and sustaining some pharmacists and keeping people coming through those doors. Michelle, what have you seen out there?
Yeah, I would tell you that addressing the primary care gaps, there's absolutely a role for retail independent pharmacies to continue to fill for these patients. I would say despite economic challenges impacting operations, the digest shows that 90% of independent pharmacies surveyed administered immunizations for the flu, non-flu diseases. So nearly 75% offer blood pressure monitoring, 45% administer point-of-care testing, and almost a third maintain collaborative agreements with other types of healthcare professionals that really reinforce team-based care. Mm-hmm. Blood pressure monitoring has significantly increased over the past 3 years. It's up 24%. So many things to think about.
Yeah, Doug, you have any insight on this as well?
Absolutely. I mean, the care gaps, we feel like pharmacies being able to provide primary or to fill primary care gaps is a big opportunity. And, we talk about when we think about the future of pharmacy, the strategy we think about is we talk about changing the pharmacy payment model, which definitely includes getting paid fairly for the dispensing of prescriptions and being recognized and paid for the services that pharmacists do provide and can provide. And as we see a growing number of primary care shortages in the country, we think pharmacists are an ideal source to help fill some of those primary care gaps. We have to be paid for it, though. I mean, we are wonderful salt of the earth type people, but we're not a charity. We're not a charity. And so we have to be paid for those things. And we see some trends growing towards payment, but those trends, we need them to accelerate. It's a bit of an interesting juxtaposition because the PBMs are harming pharmacies, but yet at the same time, we need those PBM parent companies to be paying pharmacists for the care that they're providing. So we need acceleration of payments for those services that pharmacists are providing.
For sure. I do want to talk a little bit about the care that people are doing beyond the walls of the pharmacy. We'll get into that in a second. But I do want to ask Lisa a quick question because it's about the employee number that I saw, which was a number that stuck out. On average, independent pharmacies employ 12.4 employees per location, which was an increase from 10.8 from 2023. Lisa, as far from your standpoint, when you saw this number, was this a surprising number for you? Because we've done a lot of different podcasts on pharmacy burnout and with all these added services, do you think this is more of a necessity that people were having to bring more people and employees into their pharmacists?
When I saw the fairly significant change, more than a whole number, reflecting on that, thinking about some of the things that we reported last year about why the number might have been down, we think that maybe some workforce shortage has eased a bit. Pharmacies have been able to fill some positions. You have a whole other class of graduating pharmacists and technicians that are continually being trained. Some states, every state requires some training. Many states require certification as well. And it just takes a while to get that done. But also, I think for the previous year, we anticipated quite a bit of belt tightening, anticipating that pharmacies would need to have some extra cash on hand in the first part of 2024 to make sure that they could pay the DIR double dip, finish paying DIR from the previous year while they were getting new lower point of sale price concessions for the start of 2024. So as the year went on, probably some of that cash flow eased and hiring became a little bit easier.
Interesting. Yeah, that was one of the numbers that was really stood out to me, especially talking to other pharmacists over the last year. And I just want to get your thoughts on that. So thank you so much for that. I want to go back to Michelle when it comes to the independent pharmacists that are helping their customers or their patients beyond the walls of their pharmacy. We're talking about collaborative practice agreements. LTCs in particular have been pretty popular. So Michelle, what have you been seeing out there when it comes to people, helping each other or pharmacists helping their patients outside the walls of their own pharmacy?
Sure, Jason. I would say a growing number are caring for patients in nursing homes, assisted living facilities, there's residential facilities, correctional facilities, even in their own private homes. Many patients want to stay home now. They don't want to be somewhere else getting care. The Digest shows 55% of independent pharmacies provided LTC services to their patients. And as Doug alluded to earlier, the average number of beds for long-term care at home increased 10%. My team is supporting pharmacies across the country, and they're constantly sharing different areas that pharmacists are supporting our customers and doing things outside the box, quite frankly, to drive additional revenue streams, which is much needed in the current environment.
Well, that's interesting. The LTC part of things has really grown dramatically over the last several years. And what do you attribute this to, Doug?
I think it's like Michelle mentioned, the growing demand that patients want to age at home. And I also think from a cost standpoint, I know from a cost standpoint, it's less expensive to age at home than to go into a nursing home, a long-term care facility. And I also think that what we're seeing is that pharmacists have been able to, this is actually where the Digest, one of the many uses of the Digest, is CMS has recognized that pharmacists can provide long-term care at home services. And so there are some opportunities for pharmacists to get paid more fairly, still not fair enough, but more fairly for some of these at-home services they're providing. So many pharmacists, especially I would say in the last 18 months, have begun or increased providing these long-term care services at home because one, that there's been more opportunity there, and two, it's somewhat out of necessity, and three, and most important of all, it's where patients want care and where patients do better. They thrive more at home than they do in facility, and studies have shown that. So I think we're just at the beginning of this trend, and I think it's going to continue to grow. We all know that the aging of baby boomers and frankly, Gen Xers, my generation, are getting older and older, and so more and more people will need these at-home services. And again, pharmacists are ideally situated and trained to be able to provide many of those services.
And if I may, another thing that's enabling pharmacists to provide care outside the pharmacy walls is emerging technology. So for the first time this year, we reported out on remote patient monitoring. So this year, it's a small number, 5% reported that they were doing that, but we really see that as something that's a natural fit for pharmacies to supply the devices for patients to do monitoring at home. And then for, when the data is available and there's have some sort of application that's going to analyze it, helping pharmacists understand when intervention is needed, intervention or encouragement, because sometimes the intervention isn't always correction. Sometimes it's encouragement, like you're doing the right thing, keep it up. But I wanted to flag that technology issue.
Yes, for sure. And yeah, to your point, some people like to be encouraged rather than told what to do. So I think that completely makes sense to me. When it comes to shifting the conversation now to, we talked a little bit how the Digest can help advocacy a little bit. I want to talk to Michelle a little about this because we had a great RBC out in Denver. We talked about, from a state standpoint, about advocacy and why it's so important. And the Digest showcases independent pharmacies' involvement with civic organizations, local governments. Michelle, how have you seen community and/or professional engagements impact an independent owner's business, especially recently?
Yeah, I would tell you, I hear stories from customers every single day. I think strong advocacy support from retail independents, it's driving significant change at the state level. Through the One Voice initiative we launched, as you mentioned, we're providing direct financial support to state pharmacy associations to keep this momentum going. Connecting with the state pharmacy associations can really help increase the impact of what pharmacists are doing, really by providing them with resources and helping them connect with the lawmakers to ensure that that meaningful change is going through.
Yeah, it's something we've been talking about for several years, and Doug has been gracious enough to talk about it on stage and give us a nice rundown of what's happening from Capitol Hill and everything else in between. We have Rebecca here that can chime in on that as well. Rebecca, what have you seen out when it comes to pharmacists getting more involved?
Yeah, absolutely. Well, I think we've seen incredible progress, as Michelle said, over the last couple of years, and that's because more and more pharmacists are telling their stories and they're out there talking about change, but also the future of pharmacy. A couple minutes ago, the panel was talking around bringing additional reimbursement in the door, and the steps that we've seen in the movement there is really because of the pharmacist advocacy efforts. So there's a lot of work there to go. I'd say part of our role at Cardinal is to help provide tools to pharmacists. The members of Congress and the state legislators really want to hear from the pharmacists directly. So whether it's the digest or talking points or creating opportunities, I think that's a place where Cardinal can bring attention to what pharmacists are experiencing, and also really leveraging our access in order to enable pharmacist advocacy going forward.
How would you recommend independent pharmacists leverage these 2025 NCPA Digest numbers and all these little intricacies that you're finding within those numbers for advocacy?
Yeah, absolutely. So policymakers love data and love facts. And so I think you have an entire book here, right, to help make the case about the impact that pharmacists are having and can have around access to care, but also the threats that pharmacists are facing. And as we talked about a few minutes ago, we are seeing changes there that policymakers should be aware of. And I think it gives both real life evidence of why policy solutions are needed now, but also we can't wait. And so I think seeing the data that's in here, bringing that forward, and then partnering with the impact they're having in their community is really compelling to legislators that have the ability to make a difference there with policy solutions.
How big is economic impact make when you're talking to a lawmaker about what economic impact a pharmacy could make, both just for the healthcare landscape and just the continuum of care?
Yeah, it's significant. I think when a pharmacist can talk about the role they have in the community as a constituent for their member of Congress or their state legislator, and what will happen if they can't stay in business, where will those patients go, what it means in terms of access to care, I think that is the way to connect the dots and make it real. So clearly, members are very interested in the overall economic health and viability of their communities, but I think making it clear of what the role of the pharmacist is and showing the data to back it up, it's a really compelling argument.
Michelle, you had mentioned earlier about, I think you said pharmacy deserts, correct?
Mm-hmm.
Do you think there's an opportunity for pharmacists to speak to a lawmaker on how, opening pharmacists and how these pharmacies, these independent pharmacies within a given district or a given area can help care within that given district?
Yeah, I would tell you there's even a map from USC NCPA Pharmacy Access Initiative that shows where there are currently pharmacy deserts and where patients have to travel to get access. I think this can be matched up to congressional districts, something that can really be impactful when speaking with representatives that serve that area. There's also a report that shows the economic impact that independent pharmacies have in terms of stimulating local economies and generating tax revenue. There's a lot that can be done in those areas as well.
Yes, all words politicians love. Just going to say that. Going back to Lisa and Doug, we understand the Digest has a variety of use cases for independent pharmacies, benchmarking performance, identifying new services, and, the report can also be used as an advocacy tool. How does NCPA use the report in this way specifically?
One of the other deliverables that we can produce because we have this data at our fingertips is that we do it state by state, but a state economic impact sheet that members can use. So I have the Louisiana, just because our annual convention is in New Orleans this year. So I've pulled up Louisiana to look at. There are 446 pharmacies independent pharmacies in Louisiana, and that, based on the average annual sales number that we have in the digest, we know that extrapolates to about $2.2 billion of revenue just from independent pharmacies operating in that state. That revenue employs people, it pays taxes, it also supports the community. We also know from the digest that 61% of our members of independent pharmacies support at least 5 organizations in the community. So organizations that are going to go without sponsorship for their fundraiser if there's not an independent pharmacy there to chip in a few bucks.
Yeah, I love that.
Yeah, and I'd add, so the state sheets that Lisa just described are for everyone that comes to our NCPA legislative fly-in in the spring, we arm them with those one pagers, so that when they go to meet with their member of Congress, they've got that to present to that member of Congress and say, this is the economic impact that independent pharmacies are having. These quote unquote mom and pop pharmacies are having an enormous financial impact. And because of their small businesses, they're returning those dollars into the community. They're not going, off out of state. They're being returned in the community. As far as other use cases, we put this information out there, so it goes to the pharmacy schools. So I could not guarantee that every pharmacy school uses the digest, because we know a lot of them, we need more of them to teach more about independent pharmacy. Mm-hmm. But when they do talk about independent pharmacy, they use it there. The Senate Health Committee, the U.S. Committee, the Health Committee, the Health, Education, Labor, and Pension Committee, they cited digest data in hearings related to PBMs, rural healthcare access, drug pricing reform, state legislatures, pharmacy boards, CMS, rural health advocacy groups. I mean, there's lots and lots of different places where the digest information is cited. Media, whether it be trade media or more mainstream media, they'll cite the digest as where they picked up their information. So it gets used over and over and over again, and it's really a key tool for benchmarking. I think you said legislators love data.
Mm-hmm.
And Rebecca said they love data, and she's right.
Yep.
They need that point of reference, and the digest provides it for, again, just like the Senate Health Committee and House E&C Committee, and on and on and on.
Well, going back to Rebecca and you, independent pharmacies are asked all the time, I think annually, to participate in the NCPA financial benchmarking survey when it comes to benchmarks, which helps inform the digest and give it the content it needs. Why is their continued involvement important, and how does it influence your team's advocacy efforts beyond the digest? And I'll throw this to Rebecca.
Yeah, it's a great tool for my team as well. We're on Capitol Hill every day. We're out in the States, and our desire is to reference the really good material coming from our trade association partners and help, again, to make the case as to why pharmacies both need relief, but also need to think about the future of pharmacy care. So we reference the digest. My team is armed with it. And I think the involvement of, as I said, of independent pharmacies to tell their stories and to participate in the process is critical. That's why there's been so much progress, and continue to partner going forward.
Yeah, Doug, what about you? How important is it for independent pharmacies to participate in the benchmarking survey?
Yeah, I mean, you're going to guess my answer before I say it, because it's super important. It really is, because all these things that we're talking about, if we didn't have the data to be able to report, the government committees that I just mentioned, the media committees that I just mentioned, and the business uses, like, how do you know if you're average, above average, below average? I mean, it'd be kind of like taking a trip without a map, without Google Maps or whatever map you're using. This gives you a map to help you understand where you are and where you want to go. So it's super important, the participation, and we know it's a commitment. Like, try to make it as easy as possible. And Lisa's worked hard. We work with the University of Mississippi. Ole Miss is a an excellent partner and has been for years. So the data goes to them. So it's not like staffers here at NCPA are looking at your data. We're not. I've never seen one survey, and all the time I've been here, it always goes to the university. So there's anonymity, but it's really important, and we really appreciate all of the pharmacies that take. It's not a ton of time, but it's a little bit of time to fill out the surveys, and just encourage, folks. The surveys are going to be coming out next spring, Lisa?
May, June. Yep.
May, June, and so just really thanks in advance for people to fill those out, and encourage everyone to fill them out.
Yeah, I mean, it's a no-brainer. You're giving your industry the ammo it needs to, take that to Capitol Hill and just give more significant data, more solid data that you can give, and the more the better. So I encourage everyone to fill out those data sheets when you get them, when they release. Michelle and Rebecca, given the findings presented in 2025, how do you envision Cardinal Health will continue supporting independent pharmacies across the country? Did any of the findings you saw maybe shift it a little bit? Is it what you thought it would be, or were there opportunities that arose in some of the findings you saw?
Yeah, I would say it's about where I expected based on the feedback from my team and what we hear from customers every day. But I would also just tell you that at Cardinal Health, we remain centered on supporting the future of independent pharmacy, and we are absolutely prioritizing and investing in consultative support and solutions to help independent pharmacies identify new opportunities and navigate the way forward. So our team works directly with pharmacies in the field to offer consultative support. We continue to provide multiple layers of consultation on inventory management, reimbursement, reconciliation, and over-the-counter services. This remains a top priority for us. Our LeaderNet PSAO, offered by our managed care team, been rated the top PSAO for the year, 4 consecutive years in a row. We continue to explore new ways to connect independent pharmacies to opportunities and really help them make more informed decisions on what plans will offer the best outcomes for their patients and for their business. I would tell you, we are absolutely committed to the long-term success of community pharmacy.
Absolutely. Rebecca, from an advocacy standpoint, where do you see yourselves going forward based on the findings for 2025?
Yeah, I think it reaffirmed we're focused on the right things. We're providing tools to the pharmacists to advocate. We're advocating ourselves for the future of pharmacy and increased reimbursement. And we're going to continue to do that. We just announced the One Voice initiative, where we want to make sure that the funding is getting direct to pharmacy associations to provide those opportunities. We're going to keep partnering with NCPA, bringing attention to the stories of pharmacists. And there has been a lot of progress, but there's more work to go. So I think we double down on our support and continue to prioritize it going forward.
Doug, I'm going to tee up the last question for you to close it out here. Not too much pressure. Don't worry, buddy. How can independent pharmacies access additional resources from NCPA to inform their business strategies, the advocacy efforts, or basically anything that maybe somebody found within the NCPA Digest? How can they utilize that, make it actionable? And maybe this is something that Lisa could chime in on too.
Yeah, no, great question. I mean, because at the proverbial end of the day, this information is nice and interesting, but it's got to be used. And Rebecca and Michelle just described a number of ways it can be used, and some other ways. So you take this information, someone reads it, and now they want to take action on it. And from a lobbying standpoint, advocacy standpoint, applying those data points. But other ways that people can take action on it would be to learn more about it. And so like the NCPA annual meeting, the fly-in, multiple locations conference. Yep. Michelle mentioned RBC, and NCPA does the education for RBC. So we're honored to be able to do that. But all of those things, it's not that the digest is wrapped into every one of those programs, but the digest often comes up in those programs. So that's another way to extend it. we have something called the CORE program, CORE, and that's really a leadership, marketing, and business operations program to help pharmacy owners, because it's not an old joke. Or it is an old joke, and it's not really a joke. Pharmacists, we're not taught business operations in pharmacy school, and that's more true today than ever. So when a P&L is put in front of us or a balance sheet, we don't always know how to manage that. And the CORE program, that's one of the things that it does. And I'd also mention the webinar. We have periodic webinars. Mm-hmm. So for example, we recently, in fact, last week, I just listened to it. And I thought our team did a nice job of the tax implications of the White House's big, beautiful bill. And so we had, Ollie and Scotty Sykes on, and our legislative team gave a brief overview. And then the accountants went through the tax implications, which I knew some of them, but I definitely didn't know all of them. I think anyone listening to that webinar probably could save themselves $10,000 plus with something in that bill that's going to impact them. So there's a number of different resources out there for pharmacies to take the nucleus of the digest information and to expand and expound upon it to help them manage their business better and hopefully put more dollars in their pocket.
What about you, Lisa? Any insight you have to add?
Listening to Doug, I'm just reminded that I have the privilege of working for an organization where the CEO is not out of touch. He knows what's going on. He has listed like everything that I was like, oh, I could mention that, and he got everything. I think just at the end of it, NCPA is a membership organization, and like Michelle mentioned too, some of the consultative service that you all offer. Reach out and ask if it's not something that's easy to find on a website or in a portal. Staff, we're here to make sure that independent pharmacies succeed, and we want to make you, we want to help you succeed.
Yeah, and Jason, like Lisa said, I couldn't say that better. As far as that's the only reason we exist, is to help independent pharmacies at NCPA. I want to thank Cardinal for their support of the Digest. Mm-hmm. You guys have been great partners and supported it for over a decade. I should know the exact number of years, but I know it's been well over a decade that you guys have been strong supporters of the Digest. And we couldn't do the document without your support. So we really appreciate that, because it provides a resource. It's a resource for NCPA, but really it's a resource for independent community pharmacies to help them be more successful. So thank you for that support.
Yeah, it's one of my favorite reads each and every year. I think the numbers in it are so valuable to not only help independent pharmacists, but just the healthcare industry in general. I think there's a lot of little things that everyone can learn. And Doug, a quick reminder, when does the NCPA Digest 2025 when does it drop? When is it going to be able to be shared out?
Yeah, the unveiling will be at the NCPA annual meeting, which is in mid-October.
Okay.
October the 18th through the 21st in New Orleans.
Okay.
So that'll be its unveiling. And
Sunday the 19th is when the trade show opens.
And if you really want to know the exact date, you should ask Lisa Schwartz.
All right. Well, Mark and Kyle, I wanted to make sure we threw that out there before we forgot. I know we mentioned it earlier. Wanted to reiterate it. And with all that said, I want to say thanks to Michelle, Rebecca, Lisa, and Doug for providing all their expertise and insights to the findings in the 2025 NCPA Digest, soon to come. I hope all of you listening learned a bit more about the Digest, sponsored by Cardinal Health, and how it truly provides a snapshot of independent pharmacy as a whole, and how you can use it to better your business and your position as a true advocate for all independent pharmacy businesses across the country. So thanks for listening to today's episode of the Cardinal Health Counter Talk podcast. As a reminder, if this is your first time listening, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcast. See you on the next episode. And to everyone out there listening, take care.